That is a great question. And many times, how you know that someone you love has periodontal disease is there is a very distinct malodor that when they're talking to you, it's strong. I want to say it's like a green cloud. You just know because the disease is tissue that's rotting in the mouth, and there's a distinct odor that's associated with that. So we absolutely would recommend that you refer a family or a friend member to the practice. You do not need to have to see a general dentist first. You can give my practice a call and you can schedule an appointment with me. Typically, what I like to do is what's called a comprehensive evaluation. It lets me look at every single tooth and how they fit together and how the condition of the gums are, if you're having any issues with your joints or your muscles. So I look at everything that's associated, not just with the gums and the teeth, but with all the oral structures that are associated with that. And it's as easy as calling, scheduling an appointment. If you don't have x-rays, that's okay. We take x-rays as well. That way I can visually see what's going on. Besides doing a clinical exam, I can have a set of radiographs, or otherwise known as x-rays, to be able to do a comprehensive evaluation and really determine and diagnose the state of what's going on in that patient's mouth. That's great. That's a great question. So many of my referrals, as a referral-based practice, as a specialist, that's where I retain my businesses. People refer me patients, and the majority do come from the dental community. So many times, as a matter of fact, I just had a patient who was so fearful of the dentist. It had been 10 years that she had been to the dentist, and she started noticing some of her teeth were getting loose. And so she saw a general dentist. The general dentist did an examination and immediately determined that her needs were so extensive that he said, I need to refer you to the periodontist. Not that general dentists aren't certainly capable, and they are, to take care of patients in their early needs when the pockets are 4 and 5 and 6s. Certainly a general dental office and the dental hygienist can manage those patients. But when the disease is so advanced, many times either the general dentist will say we have to extract all of your teeth, and that's not necessarily the case. Many times by referring them to the periodontist, we can be quite selective in which teeth absolutely, unfortunately, need to go and which ones we might be able to save. And like I said earlier, so many of my patients who have been told their mouths are hopeless, they need to have all their teeth removed, we're 7, 8, 10 years out where we've saved teeth by helping to provide that kind of care that the laser can do. So I do work with dentists. They're great. Their referral patterns are where they need to be. It's when they can't get the results in their practice, then they refer their patients to the periodontist.